My team at Flinders is focused primarily on prostate cancer, which I'm sure many of you are aware is a huge health problem in Australia and worldwide. It's actually the most common cancer in Australian men, causes almost 4,000 deaths per year, so a big, big issue. So we do lab-based research to determine what makes prostate tumours grow and spread around the body and become resistant to therapies. And then we use this new knowledge to identify and develop new treatments and biomarkers for patients. And I'll be honest and say that when I started working in the prostate cancer field, involving consumers in my research was not really on my radar. So when you work in a lab, it's really easy to get fixated on all the details and minutiae of your work. In my case, what makes prostate cancer cells tick. And in the process, it's pretty easy to lose sight of why you're actually doing that work. However, as my career progressed, I increasingly met community members who were interested in my research, and this was most frequently men who had prostate cancer. And as I continued to engage with these consumers, I began to realize how critical it is to hear about what's important to the people who are actually living with prostate cancer, as well as their loved ones. So with this in mind, I set about establishing a group of consumers who could be involved in my team's research. So currently our consumer advisory group comprises 4 people. 3 of those are men who've had prostate cancer, and then we also have one wonderful lady whose husband had prostate cancer. I wouldn't say I recruited this amazing bunch of people as such. The group just grew pretty organically. I will say that lots of these interactions came about via networks that I'd established with local organisations such as Flinders Foundation and Cancer Council SA. So these types of organisations are often obviously strongly engaged with consumers and are often keen to link them with researchers, so a really good avenue there. So today, in the research we're doing right now in our lab, our consumer advisory group plays an absolutely vital role. So they help us from the very first stages of a project when we're identifying the key problems and the gaps that need to be addressed. They read our grant applications, they give us feedback on whether they think the research is important and necessary, as well as whether the proposal is understandable. And actually, I guess to highlight their importance on our grant applications, I've had at least one consumer named on every grant that we've had funded in the past 5 years, so really important in our applications. When we're actually doing the research, our consumers meet with us a few times a year normally. This often involves them coming into the lab and meeting face to face. We tell them about our research and our progress, and this gives them another opportunity to provide feedback on the direction in which our research is heading. And then when we get to the stage of sharing our research findings, particularly when we're sharing findings with the public and community, our consumers are really important to help us do so in a way that's going to be sort of understandable. So I want to give you a quick example of how consumer involvement has improved and influenced our research. So a fairly big part of our research program, as I mentioned, is focused on developing new treatment approaches for metastatic prostate cancer. And this disease is currently treated with what we call hormone therapies, which are therapies that block androgen signaling in patients. And these therapies work because prostate cancer cells are really dependent on androgens, but it's not a type of treatment that cures patients. And one other important thing to know about hormone therapies is that they can be associated with really severe side effects because, as I'm sure you can imagine, androgens have lots of important roles in sort of other tissues and organs in your body. And so some of the side effects men get when they're on hormone therapies are fatigue, muscle loss, weight gain, loss of libido. There's also an increased risk of diabetes and heart disease. So lots and lots of serious adverse effects. And so when we're explaining a new idea for a different treatment approach to one of our consumers, he said to us, it sounds like it might work pretty well, but how would I feel if I was on that treatment? So would it make me feel miserable like the hormone therapy does that I'm currently taking? I think this was a really important moment for us because I realized we'd been super focused on developing new therapies that would be effective, but we hadn't really been thinking about any of the toxicities and adverse effects that a new therapy might have. And so that conversation actually completely changed our therapy development research program, where we're now really coming at it from the starting point of, can we develop a therapy that both works well, but is also associated with a good quality of life? So completely changed our research there. So I'll just finish off then with a couple of tips that I think are important in terms of involving consumers in research. The first one is that building a real, genuine, trusting partnership with a consumer takes actually a lot of time. So don't wait until you're writing your application to try and engage with the consumer. It will be obvious that it's not a genuine partnership. Try and get started on this as soon as you can. So my final piece of advice is for lab-based researchers. And what I'd say is that consumer engagement is very much possible. And not only is it possible, I actually think it's critical, because we often, as I mentioned, get caught up in the intricacy of discovery research. And I really think it's essential that our research has that grounding in the patient perspective. Thanks very much.